Hello, good evening. My name is Dr. Chudi Ufondu, and it's our weekend open clinic. Our open clinic today, it's very important and very special. Today, we're going to talk about sex during pregnancy. What are the do's? What are the don'ts? What are the facts? What are the fallacies? What are the misconceptions? What are the myths? What are the basic information you should know about making love during pregnancy? Now, the state of pregnancy, it's very sensitive for some women. Pregnancy can affect women differently. And your sexual libido can also go south or go north in pregnancy. So what we're going to do this evening is to separate the facts from fictions and help you to understand the feedbacks to all those pertinent questions regarding sex during pregnancy. There are so many people that worry for so many things they should not be worrying about. There are so many people that deprive themselves of the pleasure ordinarily, which should complement the pregnancy. So what we're going to do this evening is to sit back and look at evidence-based facts about making love during pregnancy. So please do me a favor when you join. Let's know who you are. As soon as we have a good number, I'm going to start my conversation. If today is the first day attending my clinic, I truly appreciate you for finding time to attend the clinic. Please, before you go today, click on that subscription button and also set your notifications so they will tell you anytime I come live. I normally come live on Tuesdays and Saturdays in YouTube, in Facebook pretty much every day. Now, weekends, it's about this time, 8:30 p.m. Nigerian time, 3:30 p.m. Eastern time, US. So anytime you show up about this time during the weekend, you will find me discussing about so many important topics that will help you to be happy and start your family. So let's talk about sex. You see, unfortunately, this is an aspect of our health that so many people don't like talking about. Then we joke about it, and some people don't really get the right information because it's seen as a taboo. It's a topic that it's rarely talked about because it's prohibited, it's shamed, it's demonized anytime you talk about it. How much more when you talk about it in pregnancy? There are so many things people will tell you in pregnancy. Oh, do this. Oh, don't do this. If you do this, this is going to happen. So many fallacies. So the question is, sex during pregnancy, what's actually okay? Now, if you're currently pregnant, have you noticed an increase in your libido? So libido is the ability to desire to have sex with your partner. So for some women, they will notice a sharp increase in their sexual libido, in their desire, and in their satisfaction rate during pregnancy. Now, in some other women, they will notice the opposite. So there are some women that will notice very sharp, visible increase in craving for lovemaking, and the other women will have it the other way. Now, it's completely okay if you're in any of the categories. So if you noticed it's increased, and you're not in the category of people that should put some precautions, good for you. If you notice it is decreased, it's still okay. But you have to have that conversation with your partner. So is sex the last thing on your mind in your pregnancy? Is your pregnancy challenged? Are you really worried about what will happen to the baby? Some people believe that, oh, if your baby it's developing and if you make love, the penis is gonna injure the baby, or if you pour sperm inside the vagina, it's gonna get to the baby and all that. That's not true. Some people believe that, oh, once you're pregnant and you make love, it's gonna dislodge the pregnancy. That's not true. Now, generally, if you want to get pregnant, you make love, right? Now, the question is, if you're pregnant, can you still make love? So is it okay to have sex during pregnancy? The answer is 100% okay. You can start from day one of your pregnancy and you can continue until the last day until you go into labor. Completely okay. Your developing baby is completely protected from you and your partner. There is a fluid called the amniotic fluid. and the amniotic sac. So when you go for your confirmation of your pregnancy, what we are looking out for in ultrasound is the gestational sac. That gestational sac will become the amniotic sac. Inside the amniotic sac is the amniotic fluid. Your baby will be developing comfortably inside your womb. No disturbances. And the muscle of the womb, it's the strongest muscle in the body. The major role is to protect your growing baby. So your growing baby doesn't even know what you guys are doing. Remember, there are different layers you have to pass through before you get to the womb. So you have to pass through the vagina, you have to pass through the cervix before you eventually enter the womb. Now, there are so many layers of protection for this baby. So even if you have the biggest penis in the world and you guys are doing acrobatic, your penis cannot go beyond the cervix. Even if you pour billions of sperm into the vagina, they will be completely cut on off. So your baby is completely doing fine. There is absolutely nothing contraindicated in lovemaking so long as you don't have a complicated pregnancy. So sexual activity will not affect your baby so long as there is no complications. There are a couple of women that will have complications and will tell them not to engage in lovemaking. But so long as your pregnancy is going okay, we don't have any concerns, please continue in your lovemaking, especially if you notice that your libido is increased, if you notice that you crave for sex more, use it as a source of comfort. There are so many roles sex can play in your relationship. And when we talk about sex, sex is not necessarily putting the penis inside the vagina. There are so many other ways you can engage in sex without penile sex. So please feel free and make love from first trimester, second trimester, third trimester, so long as your pregnancy is not complicated. It's okay. Now, the other question some women are worried about is, can sex during pregnancy cause miscarriage? Sex during pregnancy doesn't cause miscarriage. So having sex during pregnancy will not provoke miscarriage. Majority of the miscarriages you will have will be due to chromosomal abnormalities. Some women can also have some structural problems. So if the integrity of your cervix is not strong enough and you have cervical incompetence, yes, you can have miscarriage following the problem you have in your cervix. You can have infection. There are some infections that can precipitate miscarriage. There are some inflammations and a couple of other things we can't control. But in a non-complicated pregnancy, sex will not lead to miscarriage. Most miscarriages I've already explained it. Now, there are a couple of situations, there are a couple of presentations you will have during pregnancy and will tell you to abstain from sex because it's possible that the miscarriage has already started happening. So if a woman is bleeding, if a woman is having low back door ache, consistent, like you're going into labor, if you have water coming out of your body in your pregnancy, it's possible you're currently having threatened miscarriage. So in threatened miscarriage, if miscarriage has already started happening and you engage in sex, yes, it can facilitate, it can act as a catalyst. But by its own merit, sex do not cause miscarriage. Now, what are the best positions you can use during sex in pregnancy? Guess what? All positions are good. So long as you think about your comfort and your convenience. Now, we encourage you to make it possible to put pressure away from the pregnant belly as much as possible. So if you feel comfortable in your missionary style, which personally might not be the best position because the pregnant belly, when you lie on your back, the pregnant belly will put a lot of pressure on a couple of the vessels. So some women will feel like they are drowning in their own blood. That's the reason why we don't also want you to lie on your back. During pregnancy, you lie on your left side. But there is no particular position that is prohibited in pregnancy. Any position that gives you comfort, that gives you convenience, that puts away the pressure from the bump, indulge in that. So if you guys want to go through the doggy style, that's okay. If you woman want to be on top, that's okay. But whatever you guys are doing, be careful. No acrobatics. So any position whatsoever that gives you pleasure, it's okay. And other forms of sexual indulgences like oral sex, so long as you don't have any ongoing infection, completely safe during pregnancy. What I'm telling you now, it's what is universally acceptable. Remember, our group, we don't discriminate. We talk to everybody. So whatever interest you have during pregnancy regarding your sexual fantasies, so long as your pregnancy is not complicated, you're free to do that. You can even try some experiment. You can check out some other positions, so long as you guys are being creative and being careful. And it's what both of you agreed on. So it's important you carry your partner along. There are so many relationships that during pregnancy, they had so many problems because the woman will be denying the man without being considerate on the partner's sexual needs. The fact you're pregnant doesn't mean you are not supposed to satisfy your partner's sexual needs. So you guys have to come to terms at the table of equity. So you guys have to decide and agree that this is what you want, and both of you will be on the same page. Now, are you supposed to use are condoms necessary during sex, during pregnancy? Now, here's the deal. Condom is a barrier method of contraception. Condom is the only thing that will prevent you from picking sexually transmitted infections. Condom can only come into place if you are afraid of picking sexually transmitted infection during pregnancy. So assuming you have multiple sexual partners, or you want to avoid all forms of, sex, because you're gonna make love with a new person, or you're in a relationship where your partner is making love with so many women, or you're planning to make love with another man who is not the man that got you pregnant, then definitely you need to use condoms. If for some reasons your partner had sexually transmitted infections, it can easily get to you, it can easily get to the baby. So if we have an ongoing sexually transmitted infections which we are treating, definitely condom will come into place. So you can use condoms if you're not in a mutually monogamous relationship. If you choose to have sex with a different partner, use condoms. Now, are there times when sex should be avoided in pregnancy? Yes. There are certain times in pregnancy that we will tell you, you know what, let's suspend sex for now. Now, generally, when you're engaging in lovemaking, when we stimulate the breast, when a woman is having orgasms, there are certain hormones in the semen which will call prostaglandin that might lead to minor uterine contractions. So if you pay attention to your body, when you're making love, study your body. Don't be shy. This is your body. When you are about to climax, what do you notice? It will feel like you're going into electric shock, right? That's contractions. So when a woman is stimulated in the breast, in the nipple, or when a woman is about to have orgasm, which we call come or climax, or in the contents of the semen, there are some substance we call prostaglandin. These three factors can lead to uterine contractions. Some women will feel this and they will start freaking out. It will look like their baby is about to be delivered early. That's okay, relax. Now, if you have any of these situations during your pregnancy, you will be completely excused from making love. Any unexplained vaginal bleeding. When you are pregnant, you're not supposed to bleed. So if you went to do number 1 or number 2 and you wiped and you saw some spotting or bleeding, sex at that point will be completely avoided until further notice. Personally, I will sanction the woman to no sex. Once I see bleeding, I want to be ultra careful. I want to be ultra cautious. So I will ban you from sex once we notice any bleeding, because bleeding is a sign that your pregnancy might be challenged. If you have any leakage of amniotic fluid, so if you know you did not urinate and you notice that water is leaking from your vagina during pregnancy, it's possible you have premature rupture of water membrane. No love making immediately. If your cervix is beginning to open prematurely, so that means you have cervical incompetence, because once your cervix is opening in pregnancy, the next thing that will happen is that your baby will escape. So if you have cervical incompetence, no love making for you. If you have any placenta problem, so if your placenta is partly or completely covering the cervical opening, which we call placenta previa, no love making for you. If you go into premature contractions, premature labor, no love making for you. If you have any ongoing infections, no love making for you. So these are the only times in pregnancy we will tell you not to make love. If you don't have any of these conditions, continue making your love. Now, what if you don't want to make love at all? It's still okay, but you have to carry each other along. There are so many ways you can derive intimacy without making love. There are so many ways you can still make your man to feel good. You can use your hand, you can use your mouth. There are so many ways of getting there, my people. It's not only through the vagina. So, but you have to discuss with your partner in lieu of ignoring him. If you ignore him, you're giving him a license to go outside. And the worst thing that will happen in your relationship If your male partner goes outside to make love with other women without protection, he can pick all the nyama there. He can pick HIV, he can pick HPV, he can pick chlamydia, he can pick gonorrhea, he can pick syphilis. Guess what? If you contract any of these things I mentioned, they can badly damage your growing baby. Some babies will be born blind. Some babies can be born deaf simply from sexually transmitted infections. There are some deadly ones out there. So don't give your man a license to go out and be sleeping with other women. Now, you can still be sleeping with him and he can still choose to be sleeping with other women. That's called life. But protect yourself. Be very proactive. Know what you need to know. Practice safe sex. Make sure you keep one relationship. Go for all your ANC. And please, if you don't have any complications, relax and make love. Because let me tell you the truth. A baby changes everything. When you become a mother, there are so many things you won't even remember. There are some couples that can't remember the last time they made love. Babies change everything. So the best time to enjoy your sexual relationship, it's actually before the babies start coming out. I'm just keeping it real. Until those babies leave your house, they will continue to interrupt your sexual relationship. Some of them might even be sleeping on your bed. Okay, so that's my presentation. I'm going to quickly allow us to start asking questions. So follow COO. COO is in the clinic, Tosin is in the clinic, and Mara Kafu is in the clinic. I think it's only the three of them that are in the clinic. So the time for questions is now. So if you have any questions, please start asking me. COO, definitely, I know you're going to generate a lot of questions. Please start asking me questions. I'm going to repeat this clinic in Facebook. So immediately after this clinic, join me in Facebook and I'll repeat this clinic. So start asking your questions, please. All questions are welcome. I want at least each person to ask me 3 questions. Start asking your questions. We're going to round up any moment from now. So if you have any questions regarding sex during pregnancy, this is an opportunity. Whatever I've told you today is the fact. Stop listening to anything any other person will tell you. Don't deprive yourself of the pleasure you can derive from lovemaking, because lovemaking is anti-stress. Lovemaking is anti-anxiety. There are so many good things. There are so many derivatives of lovemaking if you're genuinely into that, because it's meant to give you some calm. It contains a lot of things that would make you very calm. Very important. Okay, how is the fetus physically affected during pregnancy? Remember, God is an amazing God. So look at all these thick layers of muscles in the womb. They are very protective. So God took time to protect the baby by taking the baby away completely from the arena of lovemaking. The arena of lovemaking is limited to the vagina. Then you get to the cervix. Then you get to the womb. So inside this womb, the place the baby is developing, the place the baby implanted has so many layers that will cover the baby until we get to the sac. When we get to the sac, the baby is comfortably swimming, developing in the amniotic fluid, completely sandwiched. So there are so many layers that will protect this baby. This baby doesn't even know what you guys are doing. The same thing is applicable to the semen that will enter the womb. They will not have any effect with the baby. So your baby is perfectly okay doing his own thing while you guys can even be making love for the whole day, and the baby will be sleeping, or the baby will be playing and doing his own thing. So there are no connections between the penis, between the whole fluid that comes from the penis during lovemaking. Your baby is completely protected. So there is no link between the baby and the penis and whatever happens during your lovemaking. For a woman who carried out sacrilege, is it safe to have sex? No. Sacrilege is one of those conditions that will completely put you in a no-go area. So because when you have sacrilege, why are we giving you sacrilege? The integrity of your cervix is compromised. So if you go making love when you have in situ sacrilege, the possibility is going to break the sacrilege down and will compromise the integrity of the cervix is very high, and you can have your baby before 37 weeks. So we're going to take the nuclear option of no sex when you have cervical incompetency, and we give you cervical sacrilege. Completely contraindicated. Does increase in amniotic fluid cause discomfort in the baby? Now, we have what we call AFI, amniotic fluid index. So there is a normal range of fluid we want to have in the amniotic sac. It's the normal. Then if the fluid is higher, it's called polyhydramnios. If the fluid is lower, it's called oligohydramnios. Now, a couple of inflammatory process or infective process can lead to increase in the production of the amniotic fluid or decrease in production of the amniotic fluid. Both of them can affect your baby adversely. Unfortunately, there is no specific spot-on unique way of managing this. Like women that have polyhydramnios, it's just going to be watchful management, expectant management. The same thing is applicable to women that will have oligohydramnios. Matter of fact, women that have lesser fluid in the amniotic sac, the babies might have problems in the limb developing because the fluid the fluid provides a lot of cushioning effect for the baby to be freely moving. So there are some babies that if they don't have adequate fluid, so that means during that pregnancy, the woman had oligohydramnios, the babies might not be able to flex and their limbs might somehow be affected. Okay? So if you develop that condition, definitely you have to be regular in going for your ANC, and we have to manage you conservatively. Okay. If a woman is close to EDD, can having orgasm induce labor? No, this is one of the myths. This is one of those misconceptions. Like COO, remember I sent you a case of one lady that her friends told she's 7 months and her friends were putting fear in her that, the fact she's no longer, having interest in lovemaking, because it can happen to some women that they are telling her, hey, your labor is going to be difficult, your delivery is going to be difficult because your partner needs to be making love to you so that your labor will be faster. Completely false. There is no association between the penis entering the vagina, whether in third trimester, first trimester, second trimester, and your labor. Your labor is a natural process. Your labor will proceed perfectly okay. If your labor is not coming, we can go and start labor. If your labor is delayed, we can augment labor. Don't worry about that. If you want to make love for making love's sake. Making love is not going to facilitate your labor in any way, shape, or form. Okay? After conception, that's Charles. That's my designer. Guy, you need to start asking questions. You're getting ready to marry, so you need to know a lot. After conception, at what month is it safe to start having sex? Who told you should stop? That's a problem. There was never a time anybody told you to stop. So you probably have some myth. When you have positive pregnancy test, nobody told you to stop. You continue. Pregnancy has happened. You can't stop pregnancy. So there is never a time anybody told you to stop. The only time you stop is when you have the conditions I've mentioned. If your pregnancy is uncomplicated, enjoy. And make sure if you're making love, you're deriving a lot of joy in it. Participate in it. It's got a lot of positive, feedbacks in it. Okay? Can love making help a woman with gestational diabetes? Completely not related. Completely no association. If you have gestational diabetes, our role is to control your blood sugar. If your gestational diabetes requires giving you oral hypoglycemics or even insulin, we do that. Now, thankfully, some women will have normal blood sugar once their delivery is done. Some women will continue to be diabetic. So there is completely no connection between lovemaking and your gestational diabetes. Please, can you explain how a woman can get pregnant for 2 different men at the same time? So this is a rare phenomenon, but it can happen. So in some women, they have very high fertility rate. It's called hyperfecundity. Now, there's a situation we call superfetation. So some women, instead of producing 1 egg, and it's expected that once pregnancy happens, it's sealed, or your cycle will be in a quiescent phase. But in some cases, some women will become pregnant and become pregnant again. Now, that scenario can happen to one man. So you can get your woman pregnant and you can get her pregnant again in 1 week or 2 weeks. In that rare situation, the woman will produce another egg, which will be fertilized by a different sperm. In some cases, people will mistake it for twins, but they are not actually twins. They are 2 separate pregnancies. Now, how can a woman carry 2 babies in her womb who are not twins, but 2 different men? The same scenario. For example, you're dating 2 men at the same time. You live in Lagos, your partner lives in Abuja. And because of that distance, you have this guy that has been admiring you, or maybe your ex or whoever it is. This is a complex society we are living in. So you can be in Lagos. You might have a boyfriend in Lagos, but your main boyfriend is in Abuja. And your main boyfriend flew into Lagos on Sunday. You guys made love, passionate love making and all that. And he flew back on Monday. First thing on Monday, he flew back to Abuja on Monday. Then immediately he flew back, maybe within hours of him flying back, your other boyfriend came in, and for you to sustain your two, it's possible that both of them don't know each other. So whatever you've been doing, both of them don't know. And probably you have your libido on and all that, and you engage in lovemaking with the second guy within that same 24-hour window. The first guy already got you pregnant. That egg is already doing its business with the sperm, pregnancy going okay, and the second guy got you pregnant. So invariably, there are some babies that we will think are twins, but they might have a gap of about 1 week or 2 weeks. So you can become pregnant and become pregnant again. So in that situation, you're carrying 2 different fetuses in your womb for 2 different men. It can happen. Very rare, but it can happen. It's called superfetation, okay? These are the oddballs in medical practice that can happen. All right. There's a myth that you've been hearing. Look, there are certain things, God is a good God. God took time to design all this whole package. Whatever God does is perfect. It's incontrovertible. Stop denying yourself the pleasures and things you should actually be getting a derivative from based on what people. There are so many things people. One day they will tell you not to breathe. One day they will tell you not to drink water because you're pregnant. So many people will be giving you every Tom, Dick, and Harry will tell you, oh, don't do this, do that, do this. And before you know, you confuse yourself. When pregnancy happens and you want to make love, make love. No contraindications, okay? All right. Is it true that sex help? Hey, Tosi, if you want to mention sex, you spell it correctly. Don't be, this is a medical group. Is it true that it helps women no, there is no connection between, going into labor and your dilation of the cervix and sex. Completely no connection. Completely. It's just a myth. The mind is a terrible tool. Whatever you believe, you condition your mind will begin to play tricks on you. There is no connection, okay? Just like there is no connection between, oh, you do this is castor oil will induce labor. If you run up the stairs, labor, and all nonsense. They're all anecdotal. They are not evidence-based. When labor comes, labor comes. When your labor is delayed, we do something. When your labor is not coming, we can induce labor. When your labor is delayed, we can augment labor. So leave that for the doctors, okay? Your labor will come, your labor and your baby will come like a thief in the night. You won't even know when they will come. Keep asking your questions, please. We have just 2 minutes before the 30th minute mark. It's quite a little bit of increase in the number of people that attended, but this group can do better. We have thousands of people in the group, but only about less than 20 attend the clinic in YouTube. We don't really know what's going on, but if you still have questions, please ask before I go. Make sure you join me on Facebook immediately. We're going to repeat this topic, and we're anticipating a bigger audience in Facebook, so you must still have an opportunity to get a couple of feedbacks if you want to do that. So are we good? If we're good, COO, give me a signal so we can go. Ask all your questions now. Don't go back and continue practicing the wrong things. This is your opportunity. Ask me questions. I think an advert is coming up shortly, so it's possible you guys will see an advert pop up on your screen right about now. It's just showing me a signal now that we have an advert interjected in this video. But before then, if you still have questions, ask. If not, admin has given me a signal. So once this advert is over, I'm going to end the clinic and we'll continue in Facebook. So thank you so much for coming. Please go and enjoy your lovemaking in pregnancy, and just make sure you're keeping your provider informed. If you have any complications, there are 3 things that should worry you in pregnancy: bleeding, water coming out of your body, and pain, pelvic pain. Those are the three precursors of threatened miscarriage. Remember that miscarriage and abortion are the same thing in medical practice. Thank you so much. I'll see you guys in Facebook in a few minutes. God bless you and enjoy the rest of your evening. Bye-bye for now.